Hello, my name is Carlin, and today I'm going to be demonstrating how to change a sterile dressing. First, I'm going to go ahead and check the doctor's orders, make sure that I have all of the supplies that I need. I have my dressing tray with my instruments, I have my sterile gloves, extra gauze, I have an alcohol wipe, Sharpie, wound measuring guide, I have some normal saline here, and I have some clean gloves. First, what I'm going to do is I'm going to come into the room and I'm going to verify the patient's identity. Hi, my name is Carlin. I'm going to be changing your dressing today. May I please get your name and date of birth?
Aria Cage, September 1st, 2008.
Perfect. Thank you so much. So today what I'm going to be doing is I'm going to be removing the dressing that you already have, and I'm going to be replacing it with a new one, okay?
Okay.
Are you in any pain right now?
No, not really.
Okay. From a scale from 0 to 10, with 10 being the worst pain of all time and 0 being no pain at all, what would you say your rating would be?
About a 1.
Okay. So now that I verified that, there's no need for any sort of medication. I'm going to go ahead and provide privacy for the patient, and I will go ahead and put on a mask for extra sterile technique, but I'm not going to put one on for this video just for audio reasons. I'll go ahead and perform hand hygiene, and I'm going to put on my clean gloves. I'm going to make sure that the patient is in a comfortable position. Are you nice and comfortable right now?
Yes.
Okay, perfect. Okay, now what I'm going to do is I'm going to remove the old bandage. I'm going to pull gently away with the tape. I'm going to hold the skin down. If the patient's skin is frail, make sure I do it nice and easy, pulling gently away. And after I get the bandage off, I'm going to assess the wound, and I'm going to look at the drainage that is on the pad. This is sanguineous drainage. So I note that and throw that away. I also note the size, the granulation, the type of drainage, the width and length of the wound. And I note that. I'm going to go ahead and take off my gloves, throw them away, and perform hand hygiene once again. Now I also need to instruct the patient not to touch the wound at all because it is open to the air, so make sure you don't touch it, okay, Aria?
Okay.
All right, perfect. So now I'm going to go ahead and make my sterile field. First, what I'm going to do is take my alcohol wipe. I'm going to wipe down my table, make sure that's nice and clean first. And then I'm going to open up my dressing tray. And of course, because I have limited space here, I would never be reaching over my sterile field, but that is how I'm going to be doing it for right now, for this video. All right, and I can touch 1 inch around my sterile field, okay, to make sure that's nice and secure. I'm going to go ahead and dump all of my supplies onto the sterile field. And this is also sterile right here, so I'll be using that for my normal saline. I have my extra gauze pad that I'm going to put onto my sterile field. And now I have everything here, all of my supplies, and I'm going to go ahead and put my normal saline into my sterile tub here. But first I need to check the date, expiration, when this was last open, because it only lasts for 24 hours if it's been open. And if not, then I look at the expiration, it's good. I'm going to go ahead and take the cap off, place it upside down, and pour some of my saline into my sterile tub. Okay. Next, I'm going to put on my sterile gloves. Now my hands are sterile, and I am going to keep my arms close together next to my body and my hands above my waist. And now I can organize everything that I'm going to need on my sterile field. Okay, so now that everything is organized, what I'm going to do is I'm going to use the forceps right here to clean the wound. So first I'm going to get it nice and wet, and I'm going to squeeze it out. And then with my forceps, I am going to clean the wound using only one stroke to clean, and then this will be garbage. I actually do have a little garbage bag here that I could use, but I'm going to go ahead and keep doing what I'm doing. Okay. And that is done. Okay, so now that I've cleaned the wound, I'm going to discard of everything there. Now I'm going to actually blot it dry with a sterile gauze. And I'm going to use sterile technique here as well. I do have another pair of forceps that I can use to make sure it's nice and sterile as I do this. And once you've blotted it with the gauze, you cannot go over it again. So just making sure it's dry. And that's done. Okay, and now I am going to keep my gloves sterile while I clean the wound. And now I'm going to go ahead and apply the dry sterile dressing. So I do have my gauze right here. Here's my first layer. I'm going to put right on top. And then I have a nice large pad here that I'm going to put on top. Okay. And now from here, I can remove my gloves and I can go ahead and tape the dressing. Washing my hands, and with the tape, and tape here. You doing okay, Aria?
Yes, thank you.
Okay. Tape it here. Tape it here. And again over here. All right, perfect. So now what I'm going to do is I'm going to take my Sharpie and I'm going to initial, time, date, and now I'm going to go ahead and clean up my area here. I'm going to tidy things up. I'm going to perform hand hygiene once again. And that's it. After I document everything into the computer, all the assessments for the wound and what I've done, and that is it. Thank you so much.